Good morning, everyone. In this May month of Metabolic Disease Review episode, I invite all of you and do a special article is presenting is presented by Dr. Kalpesh Kavar, and we have Dr. Kalpesh Kavar, consultant diabetologist from Rajkot. He is known for his awareness work as well as the scientific aspects, and his expertise had been in the diabetes care. Today, he is presenting the recently published article from Diabetes Research and Clinical Practice. The article is Low Muscle Mass is associated with progression of chronic kidney disease and albuminuria, an 8-year longitudinal study in Asians with type 2 diabetes. I invite Dr. Kalpesh Kavar to present the article and give his scientific inputs. Go ahead, Dr. Kalpesh Kavar.
Thank you. Thank you so much, Dr. Yash Patel. So, as he rightly mentioned about the purpose of this meeting is to briefly explain about this review article, and it's a very interesting article published in Diabetes Research and Clinical Practice in 2021. And basically the purpose of this article is to evaluate about the risk factors for CKD. We know that in a type 2 diabetes, chronic kidney disease is a major complication, and all the conventional risk factor, traditional risk factors that we already know, that is long duration of diabetes, hypertension, dyslipidemia, poor glycemic control. But apart from that, still many pathophysiological mechanisms we still need to understand to prevent those risk factors and prevent the progression of CKD. Sarcopenia is one of the risk factor, a potential risk factor, which is known as age-related loss of skeletal muscle mass. So the potential risk factor for the progression of albuminuria in type 2 diabetes, and with that introduction, the aim of that study is to examine the longitudinal association between skeletal muscle mass and its change over time with eGFR decline and albuminuria progression first. The second thing is to elucidate the pathophysiological mechanism between the skeletal muscle mass and CKD progression by checking the two biomarkers, that is PEDF, that is pigment epithelium derived factor, and leucine rich 2 alpha glycoprotein. So these two novel biomarker, and to understand its role in linking these two pathophysiological mechanisms. So what they have done is they have incorporated more than 1200 type 2 diabetic Asian population, and they have studied a skeletal muscle mass index by that formula. And what they have done is, over a period of 8 years of follow-up, what they eventually find out is that more than 33% of participants had a CKD progression and almost 28% have albuminuria progression. So which is a natural complication of type 2 diabetes over a period of time. Now what they find out is, with the every 1 SD variation above the baseline of skeletal muscle mass index, there was association of 18% of lower risk of CKD progression, which is a clinically statistically significant, and 17% lower risk of albuminuria progression, which is also statistically significant. Simultaneously, with the decrease in skeletal muscle mass index over a period of time, was associated with 67% of higher risk of CKD progression as compared to those with the smallest change in baseline skeletal muscle mass index. So what they find out is, with increase in skeletal muscle mass index, there is significantly lower risk of CKD progression, and on the contrary, there is decrease in skeletal muscle mass index was significantly associated with higher risk of CKD progression. And on the second indicator, what also they find out is there is a role of PEDF and LRG1 also for the linking up between the skeletal muscle mass index and CKD progression. So what they have concluded is the lower baseline skeletal muscle mass and its reduction over a time is associated with increased risk of progression of CKD in type 2 diabetic patient, and also those two biomarkers have inverse relationship between SMI and CKD progression. So with those background references, what I would like to highlight is that study was the first time ever that concluded the higher baseline skeletal muscle mass was negatively associated with CKD progression. Also, the decline in skeletal muscle mass was also positively associated with CKD progression. That highlights the importance of maintaining the skeletal muscle mass in our effort to prevent the CKD complication and albuminuria progression. So what we can incorporate in our clinical practice based on this study is we can think of measuring a skeletal muscle mass also and motivate our patient to enhance that part for a prevention of complication, that is CKD. Also, further studies are needed to confirm the role of these novel biomarkers for a proper correlation, and then we might think of monitoring of those biomarkers as well for prevention of CKD progression and skeletal muscle mass relationship. So that is all about brief intro about this article and what we can incorporate clinically with that interesting study, what have shown to us. Thank you so much.
Wonderful presentation, Dr. Kalpesh Kavar. And you rightly mentioned the take-home message from this article is the skeletal mass and the relation with CKD. Correct. And motivating the patients or the individuals with diabetes to make sure about the skeletal mass maintenance as well as the switch between skeletal mass to fat to be monitored. Absolutely. Wonderful inputs. Really appreciated taking on this article, and thank you for being part in the lifestyle disease management team, and looking forward to your further inputs.
Thank you so much. Thank you.